My name is Rick Nicolay. I'm an orthopedic surgeon with fellowship training in sports medicine. I practice at the Illinois Bone and Joint Institute. So groin pain is a common occurrence in our endurance athletes, specifically our runners. There's many wide varieties of what can cause groin pain, the most common of which would be a strain of a muscle or tendon. These are often the least concerning as we can get through them with simple conservative treatment measures. Oftentimes we're trialing anti-inflammatory medication, relative activity rest, and then sometimes physical therapy. Labrum tears can also cause groin pain. A classic symptom of a labrum tear would be pain with prolonged sitting. Lots of our patients feel the discomfort while they're running, and that can be any mixture of different conditions. But if you have pain specifically in the groin with prolonged sitting, it's a very good indication that you're dealing with a labrum tear. The most concerning of all of them, though, however, is a stress fracture. So a stress fracture would be groin pain that occurs with every step. And if it gets increasingly more painful throughout endurance, so throughout later stages of running, we get more and more worried. Certainly if you're developing a limp, that's probably the most concerning. And in that scenario, we'd always recommend an evaluation through a careful history and physical examination. We can typically determine the source of the pain. Oftentimes we obtain x-rays, and then sometimes an MRI is required to rule out a stress fracture. So stress fractures are the most concerning of the diagnoses because they can progress. If runners continue to participate in high impact activities in the setting of groin pain, the stress fracture, which is a small crack in the bone, can progress to a complete fracture, which means the bone is now broken. If that's the case, we often will perform a surgery to repair the bone. However, sometimes that surgery does not take entirely, though we don't get complete healing, and patients can progress to need a hip replacement, which for an endurance athlete can be a very poor outcome. So for labrum tears, there's lots of different treatment options we can consider for runners. Obviously, our first and foremost goal is to keep you running, keep you in your training regimen, and allow you to participate in the races that you'd like to. In the beginning, we always try with anti-inflammatories and physical therapy. If that's not sufficient, sometimes injections can be appropriate. There's different types of injections. Things like cortisone and platelet-rich plasma can both be beneficial in this scenario. However, there are scenarios where patients don't respond to conservative treatment. And if pain with prolonged sitting becomes a persistent problem, if groin pain with running is still an issue, we may evaluate you for surgery, in which case an elective surgery may be appropriate to repair the labrum. That does necessitate a recovery. We're normally talking about a hip brace and crutches for the first 4 to 6 weeks, about 3 months before patients make a close to full recovery, about 6 months before our athletes are performing back at a high level. So obviously the best treatment is prevention. So we prefer that our athletes adhere to a validated training schedule. This helps the hip scale slowly over time so that it can compensate and you're less likely to run into injuries. If there's questions about how to do this properly, there's many running coaches that can help you progress appropriately so that we can make sure we avoid overuse injuries.